So welcome everyone to today's Meet an Expert session. It's my very great pleasure to welcome Dr. Lisa Brown as wonderful to have a local speaker with us today. And I will just read out a short introduction and then we will hand the floor to Lisa. So Dr. Lisa Brown is a hepatobiliary and general surgeon working at the Royal Melbourne Hospital and Peter MacCallum Cancer Centre. In addition to surgical training, she has completed training in aerospace medicine and continues research in this field with a focus on surgery in the microgravity environment. She was the Aerospace Medicine Research Fellow at the University of Oxford in 2015, completed training at the University of Texas with NASA, internship at German Aerospace DLR, volunteer mentor with the United Stations Space for Women Network, advisor to the New Zealand Government on Indigenous involvement in the space sector, Executive Committee member of the Space Medicine Association and the Space Surgery Association. Lisa is currently the lead of the New Zealand Space Health Research Centre and is jointly developing a space surgery research group at the University of Melbourne. So once again, thank you very much, Lisa, for coming on today, and the floor is yours.
Oh, thanks so much, Rowena.
Yeah, so thank you so much. Rowena and I share very similar background in terms of the things that we've done on our aerospace medicine journey. And today I want to talk a little bit about the things that I've done, what is aerospace medicine, and talk a bit about the research that I've done in surgery and space.
So what is aerospace medicine? Well, I'm sure many of you have been interested. That's why you're coming along to these sessions. But it's the effect of being in microgravity and the vastness of space, including radiation, which can affect many parts of our body organs. So the things that you hear a lot about is the redistribution of fluid that occurs on the space station. And that's why you see in a lot of astronauts that they get very swollen, from the neck up, because the fluid that would normally be pulled down in our legs from gravity is distributing across the body. Without the gravity, it affects our bones. And so you can see this picture at the bottom right of the screen, which is the ARED, the Advanced Resistant Exercise Device, which the astronauts use up to 2 hours a day to try and combat the effects of bone loss and muscle loss. And then obviously the risk of radiation, which can cause things like cancers, particularly skin cancers like melanoma, and can have effects on our immunity in the microgravity environment. Space medicine involves looking after a whole raft of different people. So obviously historically it was always the astronauts that had the right stuff, that were very fit, highly trained, and NASA continues to train these astronauts. But as we move, into the future now and in the commercial spaceflight era, we're seeing a whole raft of different people that are entering the microgravity environment. And so like the commercial crews who, have people in their 80s that are flying to space who might have a raft of medical problems or underlying physiology which is not so strong as, a young 30 to 50-year-old astronaut. We're also starting to think about colonies on Moon or maybe Mars in long duration missions. So how can we manage astronauts just to not on the space station, but over these longer missions, which have a whole raft of different issues to identify. And then the thing that I really love about space medicine is the translational component. So we can learn things from people living in space and take that back to how we can modify things on Earth. So a really good example of that is in the early days of spaceflight, we found that the cardiac muscle was losing a lot of its strength and it was developing almost like a cardiomyopathy. And so some of the lessons that we learned from that have actually been translated back to cardiology on Earth to try and help with cardiac dysfunction. People working in space medicine, they can work in a whole different raft of environments. And I have to say, I'm not formally qualified to be a space medicine physician. You need to have a formal sort of fellowship program, of which there's only a couple around the world to train in. But my training has been sort of an interest in the educational component and then research. But these are some of my friends. So up here, top left is Dr. Natasha Cho, and she's a NASA flight surgeon. And she's worked in many crews. So classically a flight surgeon, they're not a surgeon by trade, but they call them flight surgeons. They're usually undergone emergency physician training or internal medicine training, and then a fellowship in Aerospace medicine. So they look after astronauts, they sit in mission control and monitor them throughout their mission. Also, people can work in the neutral buoyancy laboratory, which is now the second largest underwater pool in the world, where they've got a mock-up of the space station and can practice missions. Obviously, managing astronauts when they come back to Earth with the altered physiology, which they have a whole crew dedicated to looking at. And then in aerospace medicine, we can also go to more remote environments. And this is another one of my friends, James Patarini, who is also currently working for SpaceX as a flight surgeon and going down to Antarctica to look at that austere environment. And obviously, as you know, these, the big giants of space, NASA, SpaceX, ESA, as well as JAXA, so a lot of our space medicine physician colleagues are working through these industries. So just really quickly on my journey, because many of you might be sitting there and think, gosh, how do I get involved in space medicine? And for me, I'm from New Zealand, but being from New Zealand or Australia without a European or American passport, it can be really difficult to gain access to that community. But I've been very lucky that I've been been able to get involved. So my love really was always astrophysics. And this is, the famous photo recently taken from the James Webb Telescope. And so throughout high school and even at medical school, astrophysics was really my true love. And that's why I became interested in space. And I've also always loved being at altitude. And so this is Lukla Airport in Nepal, where my husband and I went for our honeymoon to go to Everest Base Camp and Nanch Bazaar, high up in the mountains there. So we've always been avid climbers and mountaineers. So for me, obviously I went to medical school. I did my intern and resident year, and then I was 1 year as a registrar, and then I was successful for general surgical training. And I did the first year of this, and then I'd always wanted to do a PhD. So I took 3 years off to do a PhD, which was in surgery, but I tried to merge some aviation aerospace in my PhD, looking at drains and microgravity, which I'll show you shortly, and also completed some astrophysics papers at the University of Auckland whilst doing my PhD. After that, I then, instead of going back to training, I took another year off where I went to the University of Oxford in a postdoc capacity as the Aerospace Medicine Research Fellow, performing research. And it was during this year that I went to the course at UTMB at Galveston, Texas. I got the scholarship to attend, and from them, and we got to spend time at NASA in Houston. And I then went to DLR, which is in Cologne, Germany, to perform an internship in commercial spaceflight. Soon after this, I was elected as the resident representative of the Space Medicine Association. I actually sat on that committee for 3 years. And then, as with Rowena, we were on the original founding committee for this Space Surgery Association, and also, like Rowena, as a volunteer mentor with the United Nations Space for Women Network. After being at Oxford, I came back and I finished my general surgical training. And during that time, I kept up my research with space, presenting at the annual conference. And then I also was lucky enough to be invited to go to Bellagio 2, which was a small invited group of about 30 space medicine people from mainly the US and Canada, but then myself from New Zealand, where we looked at translational medicine, from space translated back to Earth, and had a full week workshop in Bellagio, Italy, which was amazing, and published on that. And I got to meet some really high flyers in the space medicine community. I then started my fellowship in hepatobiliary surgery in New Zealand. And during this time, the space industry in New Zealand has really taken off, for a better word, with Rocket Lab launching. And so New Zealand developed a national space policy. I'm New Zealand Maori, and New Zealand's a small place, and everyone was aware of the work I've done in space. So I was asked to be an advisor to the government on their national space policy, and particularly on Indigenous rights with this. I also formed the New Zealand Space Health Research Centre in conjunction with another researcher at the University of Auckland, Anthony Phillips. And we've got PhD students, master's students, summer students, and we've just received a $1 million grant from the government and looking at more funding for our research there. And this is just some, bragging highlight pictures of my time in Galveston and Houston, where we got to go to the neutral buoyancy laboratory. We got to see the mock-ups at Johnson Space Centre and look inside the shuttle mock-ups. And we also got to experience being at altitude. So we got to sit in an altitude chamber and go up to 25,000 feet. We needed to see what it was like to experience hypoxia. I didn't experience for a long time, and that's because I'd been living in an altitude house in Limerick, Ireland for the few months preceding the course. And so I thought, well, I'm like completely immune to hypoxia. And then actually, no, I felt it significantly and actually had a decorticate, decerebrate response to when they put that oxygen on me after I passed out. So it looked like I had a seizure. And there is a video, but I won't show it because it's a little bit distressing actually. But it was a really great experience to be able to experience that. When I was at Oxford, I performed this study with Thomas Smith, who's now the head of Aerospace at King's College in London, and at the University of Limerick in Ireland, where we had a hypoxic house. So this screen down the bottom, this shows the different levels of oxygen that we could regulate in each of the rooms. So we were sitting at 51% instead of 21%. And I was measuring how hypoxia could make elderly people fit in a prehabilitation state for surgery, and then investigated their fitness with CPET. And this is actually my husband, when he wanted to try it out doing CPET testing. So what I wanted to mention from this is that aerospace medicine can reach so many different areas, and it's just fascinating that the research, the physiology that you can learn about, and that's what I just loved, and combining it with, surgery. So thinking more about surgery, and as a hepatobiliary surgeon, one of the operations that we do quite regularly is a Whipple, and that's removing part of the head of the pancreas and the duodenum, usually for cancer. And the number of times I've been asked, when am I going to do the first Whipple in space? So for me, that's a little bit of a joke because I can't ever see that happening. But if we think about surgery in space, I think the takeaway message is we never want to have to do surgery in space. We want to do all the options leading up to having to do it. Obviously, we need to think about how we could do it if we had to, but we really want to use all our public health prophylactic measures prior to that. And this is an illustrated version. I think most people have heard about it, but about in the Arctic, where they were on a mission, and this was the medic, and unfortunately he developed appendicitis. He was the only one that could do it, so he had to take out his own appendix, which he did obviously an open approach, utilizing a mirror. He had to have no gloves because he was losing the tactile sensation as he was feeling unwell. But he took out his own appendix and recovered and returned to duties 2 weeks later. So this sort of highlights the fact that, things can happen even when we don't want them to, so we need to be prepared. So as a surgeon, has there ever been a surgeon in space? Well, yes, there's been two, and one of them is a real hero of mine, Story Musgrave. He trained in obstetrics and gynecology and then general surgery, and I got to meet him at the Space Medicine Conference, and I was kind of quite overwhelmed because I was already a massive fan. And he's pretty amazing. When you think about astronauts and their background, you can see that he's done multiple higher degrees. He'd worked in the Air Force, and then he went on multiple missions, and he was particularly famous for the work that he did in terms of helping with the improvement of the Hubble telescope. And he was also famous, he took these pictures. He sat in the front of the cockpit in the shuttle on their descent, which they're not supposed to do. They're meant to be strapped into the back. but he had a handheld video camera, and he took pictures at Mach 15 of the plasma stream that was coming over the top of the cockpit. And it's pretty amazing. If you Google it or look on YouTube, you can see the just amazing colours as they entered its atmosphere. He also famously developed frostbite in his hand during a thermal vacuum chamber test at Johnson Space Centre over 8 hours. And he actually developed significant frostbite, lost the feeling in his hands. And obviously, with his work coming forward as an astronaut and as a surgeon, he was worried about this, but he sought help from the best frostbite expert from Alaska, and they managed to improve it to gain full function of his fingers. So thinking about surgery, or not even surgery, but how the body reacts in microgravity, we know that in microgravity there's a loss of the surface tension. And in terms of things like blood or body fluids, then this promotes the formation of domes of fluid. So you can see here on the left with the so this green glob of goo, which just automatically forms a sphere. And so this has been found with blood and using animal experiments, either in parabolic flight or on the space station, which has shown that blood does the same, and also that it actually tends to adhere to the wound. There have been a multitude of experiments looking at surgical issues in space. And as a liver surgeon, I've always been interested in what's going to happen to the liver, because at Royal Melbourne, we're a major tertiary trauma centre, and I regularly get called to major liver traumas, and obviously significant can be catastrophic bleeding. So thinking, what would happen if we had an astronaut that got injured on the space station, maybe slammed into the side of the space station for some reason and had a liver injury, what's going to happen? So this has actually been looked at in parabolic flight with a simulated liver, which you can see at the top. And then they had 10 different surgeons perform a laparotomy through a midline incision and packing the liver, using the same model on Earth, with Earth's gravity compared to the kind of close to 0G in parabolic flight. And interestingly, found actually no formal difference in the blood loss from that liver injury. That because of the surface tension and the adherence of the blood, they were able to control it just with packing pretty well. So these are really important to think in cases of trauma in microgravity. There's also been many surgical pioneers in space surgical studies, and they've been researched since really the early 1990s. And so this is Dr. Mark Campbell, who's got the moustache. He's a general surgeon. He's my mentor. And they performed laparoscopic surgery on pigs, again in the parabolas of parabolic flight, and they were able to successfully perform this. They've also performed things like thoracoscopy, putting in chest drains, putting in urinary catheters, all the things that we would normally perform either in theatre or in a trauma setting. They've also flown surgical experiments on the ISS, which the astronauts performed. So they've performed usually on rats, things like craniotomy, leg dissection, thoracotomy, laminectomy, laparotomy. And during these practice runs, they were able to acknowledge certain things, like where do you put the instruments? The instruments start flying away. So we need little holders to put things as they're performing the surgery. How do we keep it sterilized so little tiny spherical droplets of blood don't go around and contaminate the cabin? So all of these experiments have provided really useful knowledge that we can use going forward. There's a number of surgical conditions which we can encounter in microgravity, and many of these have been highlighted by NASA in their integrated medical model, which has actually just been refined since I put this slide together. But within the whole raft of, I keep saying raft today, but in the whole space of all the different medical conditions, you can see that a number of them are surgical that we deal with routinely in a tertiary hospital surgical setting. So in this, we need to think about, okay, if this happened, how are we going to treat it? And so, if you develop a fracture in space, which is highly possible, a fracture of your finger, how are you going to stabilize that fracture? Thinking about what kind of weight would a device needed, like some sort of not plaster cast, but a plastic splint. Is it something that could be 3D printed so you don't have to fly it with the weight, that it could be, made to measure for the person? Are we going to be doing things like laparotomies, or are we going to be doing robotic surgery, and how's that going to work? And then, if you get cholecystitis, could we treat it without an operation? Obviously antibiotics, but could we put a drain into it, which sometimes we do in the hospital setting? And so this was part of my work that I did in my PhD, which was doing computational modeling and doing the modeling in a microgravity environment, where we looked at things like common things we use in the hospital, like drain tubes, and what would happen if we put a drain in for whatever condition in microgravity, and is that drain even actually going to work? And we actually found that no, it doesn't work as well in microgravity, and we need to think about ways that we can improve that going forward. And what we found is that to make things like drains work, they won't work passively in microgravity as well as they would on Earth by putting them down at the side of the bed and letting things drain out by gravity. So using things like suction really needs to be utilised. So on the ISS, they have many different types of equipment available, but it's not as much as you might think. One of the crew members, if they're not already a trained doctor, they'll get trained to be the medical crew member for a space mission, and they spend time in a tertiary hospital learning things like how to intubate a patient, how to do basic surgical procedures. There's also a full medical kit which has a variety of different medications. There's equipment to be able to catheterize. They have a really multi-purpose used ultrasound, which they use for research, can use to look at things like cardiac motility. There's obviously defibrillator, ability to ventilate, and then sort of fundoscope and advanced ocular imaging because of the recent problems with loss of visual acuity, which has been happening in the spaceflight environment, which is growing lots of investigation at the moment. And as as I mentioned at the beginning, we're thinking now not just about on the space station or, going to the moon, but what about having a more longer term moon base and even going further on, several month journeys to Mars and beyond. So we can think about, or going beyond where we've been before. And so we think about the moon. Issues that might arise in terms of managing things is the extended length of habitability, the increased number of personnel that we might have in that environment, the extended length of stay in the habitat, and if people did need to be evacuated, if it was something major, how long is it going to take to actually evacuate them and get back to Earth for definitive treatment? Obviously, thinking about Mars, you can amplify all those much more. And also in this case, thinking more about extended radiation exposure. Is that going to increase the risk in women of things like breast cancer, increasing the rates of melanoma and non-melanomatous skin cancers, the immunosuppression, and how we're going to manage in terms of things like reactivation of latent infections. So all of these things are things that we need to take into account. And so I'm just training at the moment in HPB robotic surgery, and actually heard an amazing talk last week as part of the Space Surgery Association on the Nero robot, which was launched to the ISS, which is a miniaturized robot where they just launched the arm. It's just got two arms, which can have interchangeable tips in terms of using bipolar or a hook diathermy or scissors. And then the operating console is down on Earth. And so they successfully were able to utilize the robot on the ISS, just doing little experiments just with like little plastic toys and things, being managed even with a time latency. So that's really exciting, and lots of things to come forward about how that could be utilised. So as I mentioned, developed the New Zealand Space Health Research Centre, and it's it's been an absolute labour of love of mine. It's a lot of work, but we're getting there and starting to pull groups from all over New Zealand to combine their talents. And obviously I'm living in Australia, but I'm managing it remotely, which is working well. So we're looking at space health physiology. So we've got people doing laboratory experiments, medical students involved in things like systematic reviews. We are a microbiology lab where we had cell culture, and we've built a microgravity device for cell culture, which we're using. And then we've also got links with bioengineering and medical device design, which we're doing as well. And my big area of interest is the effects of microgravity on the liver. And this is what I'm currently working on. So as many of you might remember from your recent med school physiology classes about, the liver has lots of different things that it does, including, glucose and lipid metabolism. And if you have an unhealthy liver, then it can generate into a fatty liver, and then eventually to cirrhosis, and in worst cases, HCC. And what we've found in microgravity from both studies performed on rats in the space station, bed rest studies, and cell culture studies is that in microgravity, there's a change in the blood flow in the liver, and there's actually development of hepatic steatosis. And obviously, this is occurring even within 24 hours of space flight. So my worry is that with long duration missions to Mars, that we could actually have astronauts developing fatty liver and maybe early cirrhosis, and that's not going to be a good thing to have on space flight. And I'm about to start a clinical trial using and intraoperatively further evaluating this, and we've got more offsets coming from that. So that's the end of my talk, and I'm very, very happy to answer any questions that you might have.
Thank you so much, Lisa. That was a really fascinating and interesting talk, and I'm sure you've raised a lot of curly questions that the students will to put to you. So over to you. Any questions?
Hi, I've got a question. Have you looked at sort of the post-surgical recovery in space in terms of maybe wound healing or healing from fractures, and how is there any difference when that happens in space versus on Earth?
Yeah, look, that's a really great question, and so the short answer is yes, but obviously a lot of those things haven't really happened in humans to be able to formally assess it. But in terms of bone healing, there's been a lot of work done on bone at NASA and looking at modelling of the bone and how it changes in microgravity. But what I know a little bit more about is the wound healing that you talk about, and that's something that's what we got the $1 million grant in New Zealand from the government. That's what we're working on is wound healing and the way that lymphatics change in space and how that affects wound healing in microgravity. So the short answer is that it does affect wound healing. Wound healing is typically delayed. And so how can we improve that? Either with a combination of sort of advanced biological dressings and going from there. So definitely, we're not the only group. Other groups around the world have also looked at it, but yes, it is. Wound healing is delayed, that we know, so could be a major issue.
Any other questions?
Hi, Lisa. I had a question.
Yeah.
About, you said that you were saying that the medical equipment available on a space station might be almost less than you would expect. Is there anything that, like, if you got to choose what you would send up there, anything that you think would be important or maybe would be sent up more so in the future?
So I guess the thing that surprised me, so we got to see the medical kit when I was doing the course at UTMB, and obviously that was close to 10 years ago, but I've seen up-to-date things on it as well, but was the limited range of antibiotics, which, yeah, I mean, that surprised me. A lot of the medications that are there are things to help regulate the sleep-wake cycle, deal with things like, low mood, and nausea. But yeah, the antibiotic regime, I felt, I was surprised there wasn't more, but otherwise, in terms of medical equipment, it's all based on you can only bring up so much weight. So it's trying to balance the risks of what things that might happen that you might need versus, you don't want to bring up everything in case you don't need it. So to give you an example of recently, 2 years ago, one of the astronauts, they incidentally found a clot in their internal jugular vein when they were doing some research ultrasounds, and it was a complete occlusion of that vein. And so that needs thromboprophylaxis for an extended period of time, which they didn't have on the ISS. So they get it up with an extra supply to be able to, use it. So I think no one expected that to happen, but, it's sort of thinking about all those risks and what you could do. Yeah, it's difficult.
Thank you.
Does anyone else have a question? And Lisa, did you mention in one of our emails that you were supervising some students who were doing the MD discovery research?
Yes, that's right. So obviously I'm newer to Melbourne, but for the MD, gosh, I always get this wrong, 3 and 4, 2 and 3, discovery subject. So my first student started this year for her first year of that, and then she's got formal research time next year. And I've put my name in the ring again for any other students that want to join, and it's all focused around surgery and trauma in space, supervised by me and within our surgical department. So if anyone's interested, obviously most welcome. And I'm hopeful to extend the research group from New Zealand to get people involved from here. So that's a big work in progress, but that would be the plan going forward. I think, and particularly in New Zealand and Australia, we're always lots of people trying to do our little things, but I think if we combine, we can be really great. So that's my goal.
Yeah, so in the future, even though we don't have a space health subject in MD2, unfortunately, we did try to get one going on clinical medicine and surgery in space, but we didn't manage to persuade the powers that be. But it's really great that there is now the option for the MD3 for research scholar pathway, that if you're interested, you can actually work on some research projects related to space health and surgery. And during MD2, that's the time that they give you the opportunity to decide whether you want to go down the research scholar pathway or the clinical scholar pathway. So that's just something to keep in mind if you're interested in both surgery and in human spaceflight and how that all fits together. And something else, Lisa, I don't want to steal all the spotlight. So maybe with our students, we have the Space Surgery Association and opportunities for students to join for a very low fee. Would you like to mention that?
Rowena and I are on the Space Surgery Association, and it's a group of people from actually multiple different fields who have an interest in space medicine and particularly sort of space surgery medicine. And there's, I think, over 500 members now across all kind of facets. And you're most welcome to join. There's the website, if you Google Space Surgery Association, and you can register. They're having 4 times a year a big group meeting, and that's what we had last week with really interesting and engaging speakers. And there's lots of ways that you can get involved in the organisation through helping with various things from websites to different committee groups. And if you are interested in space medicine, it's also a good way to meet different people, to ask questions. And if you ever are able to go to one of the space medicine conferences, so there's the annual Aerospace Medicine Conference in the States, but there's also local ones. So there's the ASAMS, which is the Aerospace Medicine Society of Australasia. So they have an annual meeting each year in Australia, which you can come along to. And I think IAC, which is a big international astronomical congress, is in Sydney next year. So that's another local one that you can attend as well. So getting involved with these groups can help you figure out, if you want to get involved in the future. And the last group would be AMSRO, which is the Aerospace Medicine Student and Residents Organisation. And that's, if you Google that, you can also join, and they hold lots of webinars and ways to get involved as well, from being a student right up to resident registrar level.
Yep. So thanks, Lisa. So yes, there are lots of wonderful opportunities for you to get involved if you want to take your interest further. And many, if not all of those, are listed on the homepage under the extension tab. So I suggest that you do have a look at that. And on the question of wound healing, we've also got a link to there was a special journal collection on wound healing in space, and there's a link to that in your resources as well. It's definitely a really fascinating area, how the whole intersection of microgravity and immunity and things like wound healing, which are so important to the whole question of being able to do any kind of procedure in space and have it resolve successfully. So any last questions before we let Lisa go?
I just had one more question for Lisa. What made you go into general surgery or hepatobiliary surgery specifically?
So when I was a medical student in New Zealand, I did a surgical rotation, and it was by far my favourite. It was actually my last rotation of the year, and I really liked the hands-on aspect. And in terms of hepatobiliary, it's the physiology and the complex nature. It can be really difficult because we deal with a lot of patients with really bad disease, and so a lot of palliative patients, which can be, emotionally really hard to tackle. But I do find it really rewarding, and it's a constant challenge. When I was deciding which specialty I was going to do, I was already involved in aviation aerospace medicine, and everyone told me not to do surgery, and that everyone who does space medicine does anesthetics, ED, or general medicine. But I met Mark Campbell, who was the man with the moustache, and he was a general surgeon and worked as a NASA flight surgeon. And he said, no, don't do that. Go for it. Like, surgery in space is also a big thing, and we need specialists in this area. And so, I haven't looked back. And I think now, there's so many surgical areas and surgeons interested in it. So, I think it ties really well together.
Gotcha. Thank you.
And that's a really great point, actually, that if we're thinking about doing any kind of surgery, we really need to think about it in a holistic sense, that whole perioperative process. So it does involve the sort of emergency medicine aspect. It involves the anesthesia, it involves the surgery, it involves the post-operative recovery and rehabilitation. So there are lots of related areas which are still very integral to making surgery successful, whether you're talking about here on Earth or in space. So I think Lisa's sort of highlighted really beautifully that if you want to be involved with aerospace medicine or space medicine, there are many different ways to approach it, regardless of which specialty particularly takes your fancy. So thanks very much for mentioning that too. Well, if there aren't any more questions, I think it would be great if we can just say thank you to Lisa for a very inspirational and informative talk. And it's been fantastic to have you with us today, sharing your journey and all the inspirational things that you've done and that you continue to do. And it's really great to have inspirational people like you in our midst who are carrying the torch forward. So thank you very much for coming today to spend time with us. So if we can all just say thank you to Lisa.
No worries.
Thank you.
No worries.
Thanks, Lisa.
Thanks again. I'm sure you've got a really busy day, so we really appreciate you making the time to come and join us, and it was really wonderful. Thank you again.
Thanks, Rowena. Bye.
Thank you.
Thank you.
Thank you.